Welcome to another episode of the Edmonds Moms Room podcast. This is Dr. Allison Feldt, physical therapist and owner of Body Motion Physical Therapy. We help women through pregnancy and beyond so they can live active, healthy, and confident lives and avoid things like pain pills or bladder pills and bladder surgeries and joint surgeries later in life. So that's the focus of Body Motion PT, and our mission is to help 1 million moms. So this episode is going to focus on low back pain and pelvic pain in moms. Many women have low back pain and pelvic pain after babies. And when I say the word pain, I often don't actually hear women say like, oh yeah, I got low back pain or my pelvis hurts. They usually say like, oh, there's discomfort there. Or I ask about low back pain and it's just like so far gone thinking about yourself. You're like, oh yeah, my back hurts or my pelvis hurts occasionally or sometimes or all the time. And I think it's just like a part of our lifestyle. We've gotten okay living with just like this low grade back discomfort or pelvic discomfort. So there are a lot of things that can actually be happening So mechanically, as you're after babies, so let's talk about during the pregnancy, your pelvis has to spread. So at the pubic symphysis itself, you get about a 5 to 7 degree separation at the pubic bone. And so what oftentimes happens is that the glutes or the back side of your pelvis, so everything that's attached from your sacrum, pretty much if you think buttocks. So if you think about your butt, everything that's attached to that butt and your low back, that is where a lot of the tightness resides. And so tightness doesn't mean dysfunction necessarily, but a healthy, happy, functioning body without low back pain has good mobility and good tissue, soft tissue mobility as well. So the joints move well, the muscles are strong, and the tissue is mobile. So there's not tightness through the tissue. But oftentimes, there's not many moms I meet. Obviously, I'm in the profession of helping women get their bodies back and feeling their ultimate best and transforming into mom life so they can protect their bodies. But as far as low back and pelvic pain is concerned, so many women actually have a degree of discomfort throughout their pelvis or low back and just don't actually acknowledge it or realize it. And so low back and pelvic pain can be separate. So within the pelvis, you can have pain at the pubic joint. So that could be pubic symphysis pain. You could have pain at the sacroiliac joint. So if you look at your buttock and you look close to the butt crack, but over a little bit, you'll see, you'll have your SI joint. So that's at your actual sacroiliac joint. And, sometimes people call this hip pain, but this is actually pain within the pelvis. So that can be due to inflammation at one of those joints. It could be because one of those joints is frozen and actually doesn't move. It could be because there's just too much movement at this joint, or it could be that there was an actual sprain as the baby was coming through the canal and the pelvis just, there was a strain in that. Oftentimes we see that women who experience Oftentimes we see in women who had to experience the McRoberts maneuver, which is a technique in childbirth where the mother's thigh gets put up really high, up towards her shoulder. Women will end up with this SI pain or SI discomfort. And then what oftentimes happens with pelvic discomfort of any sort is you might have a continued waddle. Maybe you'll have a limp. Maybe it'll just be hard to stand up in the morning. You could get an achy butt cheek or pain down one of the back of your legs. And so those would all probably stem from the pelvis. You know, you really need an expert pelvic floor physical therapist to be able to decipher what is happening. And then low back pain. So just as in any musculoskeletal condition, you can have low back pain because you herniate a disc, or you can strain one of your facet joints. So you can have an actual, a sprain of your facet joints. So that's where like a ligament is actually a little bit strained, or just because of the postural changes in pregnancy, that can be another cause of back pain and just too much stress on the joints. So back pain is really common after babies, and a lot of the reason is because we just get we don't rebuild our cores. So if we don't have our good, strong, deep transverse abdominis, pelvic floor, diaphragm, and glutes and multifidi working together. So those are the core muscles, and we've talked about those in previous chapters. If we don't have those working together, then most likely there is an incoordination of the muscle patterns, which means that your joints are going to take up a little bit more force, putting more stress on the joints, and in turn causing pain or inflammation in those joints. And so that all has negative impacts on our ability to get back to our exercises that we want to get done, or our ability to care for the kids. I'm going to talk about a certain case here. So we've had, many moms that come and back pain is just something else that's going on, but they're not actually coming for back pain, because if it was just for their back, they probably wouldn't come to PT. They would just deal with it. Usually there's something else going on, like they don't want to be peeing themselves, or they just want to make sure they're okay to go do all these things. But then we find out that, there was some back pain. But sometimes it can be just excruciating. You feel like something's off, or something slipped, or something moved, and it is hard to walk, and it is hard to carry your baby. And even just scooting over in bed or rolling over in bed is just so debilitating and hard, that we also see those cases. So a mom recently reached out to us. She had been going to PT somewhere else, and she had debilitating SI joint pain. So on the right side, SI joint pain, and she had fairly mobile joints, so a lot of movement in her joints, and she had a long labor and delivery, and so she was pushing for 4 hours, and that's not uncommon, but that's a long time for your pelvis to be in the position where the baby is down in the birth canal, and so your pelvis kind of opens up around that baby for a prolonged period of time. And so what ended up happening is that on the very first day, we were able to determine where her pain was actually coming from. So yes, her SI joint was strained, her SI joint was sprained. However, her exact pain could be replicated when we did the internal pelvic muscle floor examination. And so that's why it wasn't caught in the other physical therapist clinic. And so we are able oftentimes to touch a muscle inside the pelvis and recreate that pain. And when that happens, it's nice because it's like, okay, let's deal with that. And then you can be pain-free relatively easy, but we have to make sure that we get to the root cause of what is causing that pain. And for this case, it was the actual delivery that was the root cause of the pain, but we had to make sure that we rebuilt the core. For number one, she wanted to have more babies, and number two, so her joints would make it and really not be worn out. Because she actually already was having achiness in her joints when she stood up in the morning. She just felt achy. She felt like maybe she had arthritis. And so these are really common things that people will describe oftentimes if their joints are taking a lot of stress. And I often find this especially true when women are breastfeeding. And so it just needs mentioning. So these are some common low back and pelvic dysfunctions that can happen with women who have just had babies. The other thing that we constantly do is, we're throwing our babies on our hips, and maybe if you have a prolapse, that is a good move. Don't take the pressure off of the front of your body. But if you don't have any other issues, throwing a baby on your hip is going to cause other issues because your skeleton and your stability and your strength in your core hasn't fully come back yet. Throwing a baby on one side of the hip or the other is actually going to really increase strain through those joints and can be a cause of a lot of pain. But I totally get it, and I'm a mom, and I definitely throw my kids on my hip sometimes when, especially, for prolonged holding and baby holding and sitting. But, carriers are a great option. Of course, strollers are a great option. But in all reality, when we pull our kids out of their cribs or their beds, they just want to be held or brought downstairs. And so we just have to do that mechanically correct. And, you don't have to live with back pain and pelvic pain postpartum. And really, you shouldn't. In order to protect your body, you don't want to live with these things. And so there's a lot of tools and tricks that exist to help decrease instances of low back pain and pelvic pain. And so I hope that you will find help. And if you do have back pain or pelvic pain during the postpartum period, you absolutely need your pelvic floor assessed. Don't let your pelvic floor not get assessed, because a lot of the time the issue lies within the pelvic floor. The other thing that I want to mention with pelvic pain is some women find intercourse uncomfortable postpartum. And we talked about that in the Returning to Intimacy episode. But there are other soft tissue problems that can happen in the pelvis that can cause numbness, tingling, burning, aching, make it really uncomfortable to sit. And those are all pelvic pain issues as well. And it's important to get those checked out if you've ever heard any of your friends say that, or if you yourself have ever experienced any of those symptoms. All right. Thank you for tuning in to another episode of the Edmonds Moms Room podcast. We hope you got some value from this podcast today, and we look forward to working with you soon.
The Edmonds Moms Room podcast is brought to you by Body Motion Physical Therapy. We help women through pregnancy and beyond so they can live active, confident, and healthy lives.